continuing with talking about people that are having pain down the back of their legs, sometimes that can be caused by tension in a certain muscle that's right in the back of the butt muscle, in the back of the hip. That muscle, when it gets tense, it can be pressing on the nerve, and that causes those symptoms down the leg. So when we're trying to restore motion of the back, restore motion of that nerve that we've talked about previously, and restore the ability for that nerve to conduct, we need to take that pressure off of the nerve, because that can all be causing the same common symptoms. So one of the things that we want to try to do, sometimes we can use a foam roll. That's kind of a good starting point. It's a little bit easier. And if you have a foam roll that has those little nubs on it, that's great. That works just fine too. What we're going to do is we're going to sit right on that foam roll, right? And I'm going to slightly roll towards my painful side. We'll call my left side. And I can just kind of roll back and forth here and kind of work into that glute muscle, my buttock muscle, right? And from here, I might find that I want to work a little bit more the side of my hip, and I can kind of roll into different positions and work that. Front of the thigh, all different positions. But a good way to challenge that, increase the value of it a little bit more, is when you're sitting on it, is to cross that affected leg, the ankle across the other opposite knee. Right? Because now from this position, I can really get into that tissue, and I get a lot more work into that same area using the same tool. So the foam roll is really great. Like I said, the nubby one will work really well too, really get into those tissues a little bit more. But as you progress from that, I think what also works really great is the lacrosse ball, right? So lacrosse ball is firmer, it's smaller, it creates a little more pressure, but it's a great tool to use, right? So I can start just sitting and kind of sitting right on top of that ball, and I kind of roll around on it back and forth, maybe up and down, left and right, trying to find my tense areas, right? When I get to a tense area, I can stay there. I can work on some leg mobility. So maybe I'll just roll my leg out and in as I do that. Maybe up and down with my leg might work with that. Maybe rotating my leg in and out might work better. And then again, as I want to get a little more intense with that, I can try that cross-legged position. So I'm going to cross my affected ankle over my opposite knee, put that lacrosse ball right underneath that butt muscle, and as I roll towards it, I can again work in that area, get a little more intense of a feeling. From here, I can try to move my knee back and forth here, or I can just stay on my position and hold it. So that's another way that we can work on that muscle that affects that nerve that might be giving us symptoms down the back of that leg.